Let's go ahead and open up the doors to Daily with Doc. Hello, everybody. We are a live show. So if you are watching us on any platform and you'd like to come into the Zoom room and join us, you are more than welcome to. Go to Daily with Doc, Zoom.com. That is Daily with Doc, Zoom.com. And we've got a whole crew here waiting for you. And today is kind of our kickoff as we're bringing back Tuesdays to Daily with Doc. So I'm super excited to be able to do this as we have so many amazing naturopathic doctors, medical professionals that just have a passion for one, health, two, natural health, three, people, and making sure that people get the information that they need to empower the individual so that they do not have to be slaves to a pharmaceutical that is just managing for health. Well, on Daily with Doc, we are a resource for an amazing community where we provide information that puts your health back into your own hands, and we present it through ways that are more natural, cell building, and supports the body instead of suppressing the body's natural response. Well, today we have with us an amazing doctor. I just spent several hours with her this past weekend in Mississippi, where she is also a master herbalist, which is kind of where my heart has started in finding solutions for my own health. But I know there was something still missing. And that's when I found longevity, that missing piece. So, and I was super excited when I saw that we had the Stay Natural line in the longevity line of products, because it had those herbs that I was mixing myself and putting together in formulations, and I no longer had to do that. So folks, you're in for a treat, because we're going to be talking about this barrier, the barrier between the blood and your brain. So we're going to free the noggin by letting you know how to get past that barrier. If you were invited by somebody specific, make sure that you get back with them. They cared enough about you to share this program with you that you need to, one, tell them thank you. Two, say, hey, I want a better health journey. Can you help me find it? And chances are, if they share this program with you, they absolutely have the connections to help you find that better health journey. So folks, without further ado, I am excited to bring to the screen with me Dr. Laura Dennison. Dr. Dennison has been on this journey to finding solutions for herself, her family, and that just turned those solutions with success into a business, into a product line that she has designed herself, that longevity found so amazing that they wanted to incorporate it into their line of products as well. And I'm so glad that they did. Dr. Laura, thank you for joining us here on Daily with Doc. You are just amazing. Folks, Dr. Laura Dennison, naturopathic doctor out of Oklahoma. So
Yes,
how are you today?
I'm doing great, Becca, and thank you for having me on this show. I know this is an incredible thing that you do, is educating people on nutrition and different products out there and helping so many people. So it's just a pleasure to be on your show.
Well, I looked and looked and looked trying to find solutions, and I wasn't finding anything that worked for me. So when I did find something that worked for me, I'm like, okay, Lord, show me, teach me how I can get this information out. And he has just blessed me to be able to do so with an amazing team, surrounding myself with doctors and medical professionals and health enthusiasts like yourself. It has just been such a journey and honor to be able to present the information that you and others bring to the table that truly is because we want to help others. So thank you.
Well, you know, and Becky, you said something, and not to get too spiritual, but you know, God does provide the answers. You just have to be willing and receptive to receive the information. And you know,
Absolutely.
God put it on our heart many years ago to change. Because you know, Stan, he was diagnosed with Barrett's esophagus, and so that's how we found this company and started these products. And you know, I couldn't imagine if we would have had our blinders on and we just went one, you know, westernized medicine route, because you know, I wouldn't be here talking to you today, and Stan probably wouldn't even be here. And so it is life-saving information, absolutely.
Yeah, absolutely. So now we're getting that feedback. I wonder what's up with that. Folks, there are so many different labels and titles that people are given whenever they have a collection of different poor health conditions. So my encouragement to you is don't claim that label, because what you're going to hear on today's program, especially if you've got things going on with your brain, your memory, all that cognitive stuff, you're going to be hearing some solutions today. So I want to do a little shout out, say hello to all of our YouTube, our Rumble, our Spotify, iHeart, Brighteon, Facebook. See, I'm getting smarter. I got a list. Radio Public, Castbox, Google Podcast, Instagram, Patreon. Hello, Amazon Music. And we are still airing on radio with KSCO and KOMY. Just want to say hello to all of you, because you are all important. You are not listening to this program just by accident. There is something here that is either going to speak to you or someone you know. So make sure that you share this program, as we are Critical Health News and Daily with Doc out on all of these different channels. You'll be able to find us. Now, Dr. Laura, we're talking about a barrier between the blood and the brain. So what I would like to do is I'd like to just turn the show over to you for a bit and give us an introduction to it, and then let's go deeper.
Okay, so you guys, when we think about a barrier, we think about, you know, like Fort Knox, okay? And God designed our body where there's this blood-brain barrier, so it doesn't let nutrients, you know, things that's not supposed to get to the brain, you know, get, you know, absorbed into the cells. It helps with bacteria. It helps with, you know, making sure that, you know, you don't get, you know, certain things to the brain, because it's so protected. God wanted us to protect it in a way that it's only going to let the good in, and to help with, you know, different, you know, bounds of healing. So when we talk about this, it's actually just a barrier around the cell, okay? And it's that blood barrier. So here's what happens in the medical world. It's hard to get even prescriptions to be able to break that barrier, okay? And so there's a lot of things that gets studied, and you know, trying to figure out, you know, what can we give the brain? What can we give the brain? Especially, you know, we know in the late, especially in the last 10 years, 15 years, you know, the diseases of the brain. You know, they're really doing a lot of scientific research on Alzheimer's and dementia, and you know, so it's become a focal point in the medical world. Is what can we feed the brain? What can we give the brain to cross over that blood-brain barrier? Okay, and so it protects things from not getting in. Okay, and then there's only a few things that can cross over and actually feed the cells, feed the brain. And so, you know, it's not like the gut, you know, it's not like any other organ in the body. It's got this level of protection that if things cross over that shouldn't be there, then it can make you really sick. Okay, and so different proteins, sometimes that you'll get the senescent cells that cross over and you can't get rid of. There's a lot of what got me on this topic today is one, I love talking about things that can actually feed the brain. Okay, um, but I had a client that it's called Lyme Brain. Okay, and so things did cross over that shouldn't have been there. Okay, and so we're working really hard with this Lyme, which is a bacteria. These spores that actually crossed over, and so it can happen, and it's whenever that permeability, um, uh, that breakthrough of things that shouldn't get in there. When that happens, then there's an urgency to be able to make the change and try to do natural things or prescriptive things to actually get rid of it. So it is an interesting topic. I love talking about it. We have several products that do cross over the blood-brain barrier, and it can feed the brain. And so from cognitive function to getting rid of debris. Okay, we talk about uh, how our body naturally is there's a lymphatic system, okay, that helps to get rid of debris out of the body. Well, now they have discovered that the brain also has what's called glymphatic um, system. So then, and the only way you can get rid of debris in the glymphatic system is to be able to get a good night's rest. When you get into the REM sleep and your eyes start going back and forth, that actually is called the glymphatic system, and it's actually helping to get rid of extra proteins that shouldn't be in the brain, extra, the senescent cells that shouldn't be there, that's just hanging out, that's just waiting for the right time to cause destruction. And so even getting a good night's rest and getting into that REM sleep can actually help to protect the brain and get rid of things that shouldn't be hanging out there. And so it is something that, like I said, it's like Fort Knox when you think about the blood-brain barrier. And so you got to think that that there's this level of protection. So you always want to feed the body the nutrients that can actually cross over and help the brain in so many different ways. Memory to cognitive function to I've had a product that have had for years, and it's called Stay Young, and we'll get into products in a minute, but um, you know for people that have had strokes. They need that extra nutrition. They need that extra, level of being able to, because, the brain has been damaged. And so they have to have something to help to renew the cells to actually cross over that blood brain barrier. And there's only a few nutrients that do that. So,
Well, there are just a few nutrients, and I love the fact that we know, because of people like you, which nutrients those are. So I'm excited, and I think one of them that you are going to be sharing with us and referring to, um, one of our brand ambassadors for that product is also on the call. So I hope to have her on with us one of these Tuesdays where she can share more about the Renew IQ, because I know it's doing amazing things and helping not just adults, but our kids. Absolutely. So when we're looking at, and you mentioned Lyme, I have so many people that are reaching out because they've been dealing with Lyme disease for years, some decades. How is it that something like Lyme, a bacteria, can cause such havoc on our body as a whole?
and and with Lyme, it also gets misdiagnosed. There's so many people that will have different symptoms, and it goes back to Lyme. And we're talking about, because a lot of people just relate it to getting bit by a tick. Okay, and
Right.
then they say, okay, well, I don't live in that region that has this spore, so how could I have Lyme disease? Well, it goes into more. It goes into mold. It goes into different fungi that actually could be harboring in your body. And then when your body is stressed or the immune system gets low, then it starts to attack. Okay, so a lot of different autoimmune conditions are are diagnosed, when a lot of times it has to go back to that bacteria that is in the body in that Lyme. And so it does take special testing to be able to test it. And most doctors don't even know, anything about Lyme. I mean, they go more towards, oh, you got lupus or you got rheumatoid arthritis, which, all can be diagnosed correctly. But a lot of it stems from actually the Lyme disease, okay, caused, the bacteria to be in a body, and it always settles in a different area. The gentleman I'm talking with and helping, and we did all the testing and we know it's Lyme, but he is, he has the symptoms like Alzheimer's, okay, he can't articulate his words, he can't, his memory, the cognitive function, and so now, experts in the industry, and there's a lot of people writing different books and research on Lyme Brain, and there's actually Lyme Brain. It's where that bacteria is up there. So, you have to hit it hard with antibiotics. And I know Dr. Wallach and Dr. Glenn, they all have a Lyme protocol, which, the killer biotic is one of those that's part of that, because you got to get rid of the bacteria. And then you have to go through a healing of, healing of the gut, healing of that, that villi, and getting enough good bacteria back in. And so, yes, Becca, it is so misdiagnosed, and I'm getting more and more calls on Lyme disease, and so I think that it's, and when you think about it, our food supply, I don't, there's a lot of ways that you can get it, and it all has to do with how your immune system is going to get rid of it, and your lymphatic system, and that's why I love talking about the brain today, especially the glymphatic system. Okay, he wasn't sleeping. My client wasn't sleeping. We got him to sleep. Okay, that means he's getting rid of that debris. He's getting into that REM sleep, and he's more cognitive. He's actually, waking up without a headache, and so there's so many things that also goes into brain health. Okay, and you have to think about your sleep. I know I'm very proud of Youngevity, because they've came out with a whole sleep pack, and it's just amazing, because you guys, here's what happens when you sleep is you're repairing and restoring and getting rid of things that shouldn't be there. Okay, and so when you have a good night's rest, okay, you're making necessary hormones, you're healing the gut, and also the brain. You're getting rid of that excessive debris that's just hanging out, and most of the time it's protein. Most of the time it's these senescent cells that's just hanging out, waiting to cause havoc, and so even a good night's rest is very important.
Well, there's some sleep is overrated, but it is not overrated by any means. So for those of us who have said that, and there's a few people on here that are hearing my voice, we got to get over that, because that is part of having real health, is getting that good sleep. And she's not saying lymphatic, it's glymphatic. You got to put that G before the lymphatic part, and making sure that we are looking at the body as a whole. So let's go through some of the things that are not able, or are able, or what makes them able to cross that barrier.
Okay, and so when you think about crossing the barrier, there's just certain nutrients, and it's like they're nanoparticles. Okay, so when you think about that, you're talking about like very minute, very small molecules that can actually go through and actually break that blood-brain barrier and be able to feed the brain. Nootropics are a great way to pull from. And before I go into the herbs and different things, a lot of people don't realize, I know we talk about deficiencies, and especially whenever we're talking about cognitive function in the brain, there is so many deficiencies that also goes into brain health. Okay, And so, some of those are folate. A folate deficiency can cause conditions with the brain. The omega-3 fatty acids, okay, that's another thing, which we all know that also reduces inflammation. But when you have that deficiency, it can also cause havoc. B12, which B12 is one of my favorite vitamins, okay? And the reason is because it does help the central nervous system. It does help the brain neurotransmitters fire. I mean, that central nervous system, and being able to, even make necessary hormones with the B12, like dopamine and serotonin and all those that are being made, that is so important with those brain neurotransmitters. Just being happy, that B12 is one of those, and B6. So the B vitamins play a big role, and in vitamin E. And I know that we talked about uh, over the weekend, we were talking about expensive pee. Okay,
Yeah.
yeah. And so you guys, that comes from the B vitamins mainly. So when you see a bright color, then your body's getting enough of those nutrients. And so it's so important to have that color of urination, because it is so important, because it lets you know that you're getting enough of your B vitamins, which is important. Um, you know, on the other spectrum, like on prescriptions, okay, some things that cross over the blood-brain barrier, that they have found out is lithium. They used to treat anxiety and depression, and in mental hospitals with high doses of lithium. Okay, well, we
Mhm.
know that lithium is part of the nutrients in our soil, and so we get that whenever we're a part of that is in our plant-derived minerals, okay? And so it's, one of those nutrients. And so, but on the prescription side, that's what they, treat a lot of people with, is with lithium. And as far as, with brain health, and they do it in mega doses. And so as a prescription, that's not good for you. But if you're getting it naturally, okay, you're feeding the brain. And so that's where those minerals come in. Um, I love, and I know Becca does too, is we love herbs, okay? And we love the functionality. Whenever I came over, we brought the Stay Natural brand over 10 years ago. We've been here for 10 years in longevity, which is super cool. But our product that could cross over the blood-brain barrier was a product called Stay Young, okay? It's a super antioxidant. Um, and super antioxidants, that's what you got to, yeah, that's what you have to realize is when you're talking about crossing over the blood-brain barrier, you're wanting to feed the brain with super antioxidants. Okay. And so the Stay Young has the grapeseed extract, okay, which is a form of resveratrol. And it also has the pine bark extract. Both of those are super nutrients to cross over the blood-brain barrier. So before we came over with longevity, this was our brain product. This was what we were using. And like I said, I had, my mom, she's a funny one. She does crossword puzzles, because we're taught, okay, to keep your brain active and do the crossword puzzles and different things like that. And she will not go without this product because it helps her to finish that puzzle. Okay, and so she believes that the Stay Young helps her to do that, but she can actually tell the difference of when she doesn't take it. And it's very anti-aging. There's other ingredients in there that it's got the hesperidine complex, the citrus bioflavonoids, which both of those are, when you think about those, one is from the pith of the fruit, okay, and so which is the rind, and it comes from lemons, limes, citrus fruits. But then the other is what comes from the actual fruit. Okay, so your citrus bioflavonoids it actually comes from the fruit, whereas the hesperidine complex, which is such a cool ingredient, but it actually comes from the pith of the fruit. So the rind, which is, there's so many benefits to that. But it also helps you to absorb your nutrients. Okay, so just a little tidbit there. We always talk about absorption, and those are two of the cofactors that helps with absorption. And so that was the product we were always using. Well, when we came over with longevity, you guys, we have so many incredible antioxidants. Is it okay for me to just go ahead and talk about products, Becca?
Yeah,
Okay,
absolutely.
okay.
And before you do, before you do, folks, we want to make sure that if you hear something that is really flipping that switch for you, get back with the person that shared this program with you. I'm serious about that. Get back with the person that shared this program with you. If you got information about this program from an email, text message, reply back to that email or text message and say, I want more information about whatever it is that you are hearing that is catching your attention. Now, if there is no one to thank, we do have a store at dailywithdoc.com. That's dailywithdoc.com. But I want to make sure that everybody gets back with the person that shared this program with you, because we are a resource for an amazing group of individuals who have taken health and the solutions that longevity provides as part of their livelihood, not only for their own health physically, but also financially. So get back with them. So Dr. Laura, please, let's talk product. And I know you,
let's talk products.
so you have a program called Let's Talk Product, which I absolutely love. It's bi-monthly. So that's something, if anybody wants more information about that, let us know and we'll get that information to you as well. So go for it.
Okay, so and that is probably my jam, is products, and I love ingredients, and I love to study in the functionality. And so when I see a superior ingredient, I just get all giddy. I'm just, I love, because I know the difference that product is going to make for someone. And so there's 3 top products that we have that can cross over the blood-brain barrier, and each one of them are different. Okay, each one of them has different ingredients to help with different. Can you do it with just one product? Absolutely, but I take all 3. Okay, because I want to be sharp. I want to be, I want to feed my brain, and so that is, and I love the whole aging gracefully. Okay, the anti-aging, and that's what antioxidants do as well. Okay, and so okay, so Stay Young is from the Stay Natural brand. Okay, and then another product, and I could not find it for some reason, but I take it daily. But if you saw my house, sometimes I have this bag over here with products in it. But Cell Shield RTQ. Okay, Cell Shield RTQ is a longevity product, and it's a super antioxidant. Okay, it has an ingredient that has been really studied for the brain, called Japanese knotweed. Okay, it is another form of resveratrol. Okay, so when we're talking about resveratrol, you're talking about red wine, the different antioxidant capability that you can get from red wine. Well, you're not going to want to drink a lot of red wine, and so you want to supplement with products that actually have ingredients that help. So Japanese knotweed is one of the ingredients that also is super powerful whenever it comes to crossing over the blood-brain barrier. Yep, she's got it right there. Now, also in this product, okay, and so and I love how they named it Cell Shield RTQ. There's other, it's a super, like I said, antioxidant, but it's also great for inflammation. It's got the curcumin, which is the curcuminoids, which is the turmeric. That's also in that product. It's got quercetin, and it has the Japanese knotweed. You guys, only 3 to 4 ingredients goes into this product, but we're talking about 900 milligrams. Okay, that's another thing that I look at. Okay, is because as a manufacturer, you want to have the biggest bang for your buck. Okay, and so they put those 3 ingredients in there, and so one is reducing inflammation. The quercetin is a super antioxidant, and then the Japanese knotweed is the one that crosses that blood-brain barrier. Okay, it can actually cross over, and it's one of the superior ingredients to do that. Okay, so that's another one of my loves of products. Okay, and just a note on Japanese knotweed, it's especially high in resveratrol, and it has been associated with anti-tumor, anti-inflammatory, and heart protective effects, among others. Okay, so there's so many incredible things that goes into that one ingredient. Okay, and so that's Cell Shield RTQ. Okay, now my lovely product that I get testimonies all the time, and I think that the brand ambassador is on here, but it's called Renew IQ. Okay, you guys, I can't describe how important this product is. I mean, it's just so powerful. And I'm going to talk about the ingredients and why it crosses over the blood-brain barrier and which ones, causes that. Because we think of it and it says that it's a brain performance formula. It is. Everything is designed around the deficiencies. We talked about B6, we talked about B12. That's all in the Renew IQ as well. In fact, it's got vitamin D, B6, folate. Okay, all those deficiencies. See, this product has been designed to get rid of to replace the deficiencies of these vitamins. It's been studied to show that Alzheimer's patients and dementia or even ADHD, all of them have some form of deficiency of certain vitamins. Okay, so they have proven this time and time again that when you have a cognitive impairment, that you're actually deficient in these nutrients. Okay, and they put this in this Renew IQ, which is, it just blows me away because I always look at herbs, but then, they also are replacing the deficiency. So vitamin D, B6, the folate, and the vitamin B12. There's 500 micrograms of the B12, which is 8,000% of your B12. So that expensive P that we were talking about, okay, we know that we're getting a good level of your B12 in this product. But here's the most super ingredient, okay, and it's the Bacopa monnieri leaf. Okay, this is the one that crosses the blood-brain barrier, and I'm going to just talk about besides the cognitive function, besides all the information that you get about this, but it significantly improves the speed of processing visual information, learning rate, and memory. Okay, that's why when kids, my team, this is one of the key products that they get children especially on, because you get kids that have ADHD or ADD, and they get on this product and all of a sudden they're able to start processing. Okay, they're able to start learning and focusing, and so it's just a pretty incredible ingredient. It's the Bacopa monnieri leaf. And there's other things that it does. Okay, it's very anti-inflammatory. Here's 7 benefits that it does. It's very anti-inflammatory. It also is a super antioxidant. The fat molecules react with free radicals and undergo a process called lipids. This is that damage that we were talking about earlier. Well, they have proven that the Bacopa monnieri leaf actually helps the lipids, which is your blood, okay, the fat in the blood, and it actually helps to destroy the free radicals that is, those senescent cells. And so that's another thing that's done, but besides feeding the brain, is actually helping to destroy what's hanging out. Okay, those senescent cells that we were talking about, those bad lipids, or even those senescent proteins, which a lot of people don't really understand that hangs out in the brain. But it reduces, and these are things that are studied, okay, on this ingredient alone. I'm not saying the Renew IQ, even though we get a lot of outstanding results. But here's one of the studies that they did on ADHD. They took a study of 31 children aged 6 to 12, and they gave them 225 milligrams of the Bacopa monnieri leaf for 6 months. Symptoms such as restlessness, or self-control, inattention, and impulsiveness in 85% of the children was gone. Okay, in this 6-month study, they proved that this one ingredient can actually reverse the symptoms that goes into ADHD, and that's the results that we're seeing. I mean, it's just pretty incredible. We had a great testimony this last weekend. And they've only been a part of Longevity since June of last year. And the child had always, and I have permission to share this, the child had always struggled at his grades. And, they put him in private school. They also had him held back a year. His older siblings were very smart. One graduated from high school 2 years ahead of schedule. And here this child was struggling. He's 14. and he struggled his whole life. They held him back in fourth grade. So since fourth grade, they're still struggling of making the grades. He is making straight A's, you guys, and he got on the 90 for life, okay? And he got on this Renew IQ. That's the only thing. Well, and he takes my Stay Clear because of his blemishes, but it is changing his life. You know, his brightness that you see, because I get to see him once a month because we do a meeting down there, and just seeing the change of his confidence, seeing the change that, you know, I'm not such a different person out here. And, you know, because they labeled me ADHD. Okay. When kids get labeled that, then, you know, you have the stigma. And, you know, Becca was talking about that early, these labels that westernized medicine tends to do to us. You know, I'm just so excited. He's looking forward to college now. He's looking forward to, you know, his whole life, because he had struggled his whole life with school. And when you have somebody like that get the results like they did, you guys, this is life changing, and it is just super exciting. But that's the main herb that has been studied. Like, you know how we always talk about PubMed and how that's unbiased information. Just go on PubMed and type in Bacopa Monera leaf, okay, in brain health, and see all the studies that they've done. It's just incredible to see what that nutrient can do, okay? It also has the rhodola extract. It has the grape skin, okay? So now we're back into the resveratrol, okay? And that crosses over that blood-brain barrier. And the Palagium okay, root extract, which is also another form of resveratrol. Okay, and resveratrol is another ingredient that has been highly studied to cross over the blood-brain barrier. And so you got to have nutrients that can cross over. You got to be able to feed the brain and let these nutrients go in and actually help the cells in the brain to start restoring, repairing, and making those connections. You know, a lot of people, you know, they don't understand that, you know, God designed us in a way that every system in the body, you know, from blood flow to absorbing nutrients, the cells, the repair. I mean, it's just incredible. But the brain is so protected, because if it wasn't, I mean, you know, any bacteria or anything could, you know, creep in, you know, you know, you're gone. Okay. And so it is something that they did, that God did very well, and it was to protect the brain. And so, so I love being able to talk about different nutrients that can actually cross over. So those are my three top products. I'm sure Longevity has more. And when you're looking at antioxidants, that's you know, one of those. But then this is specifically a brain performance product. Okay, it was designed specifically for that. And the others, Stay Young and the Cell Shield RTQ, is an antioxidants that can cross over the blood-brain barrier.
Okay, so I want to point out a couple things here, folks. Okay, your brain is right here. Think about all the openings to the body that are so close to the brain. You've got your mouth, you've got two nostrils, you got your eyes, you got your ears, the skin, especially ladies, for those of us that put on stuff on the skin, and I know some men that do too, whether it's just moisturizer, whether it's nutrients that are using some type of carrier. We want to be super, super cautious about what we're putting on our skin, especially when we're so close to that brain. That brain is so delicate, and there's so many things that can affect it. The bacteria, so many openings that can get in. We really need to be cautious, folks, and aware of what's around us in our environments, what we put on our skin, what we put on our mouth, because all of that matters. Now, you had mentioned the different studies on specific ingredients, which I absolutely love. Now, folks, this program is not meant to take the place of your primary care physician, nor is it meant to treat, diagnose, or cure any disease. When you give the body what it absolutely needs, plus when you've got that decline happening, it needs extra. the products that Longevity offers are not meant to treat or cure anything, but the nutrients within them have studies that go on and on and on. So why would they take and multiple nutrients and put them together, Dr. Laura?
Okay, so, well, that's a good question. And when you take multiple nutrients, okay, you want them to, one, you want them to work effectively. So when you look at a product, sometimes the ingredient that's in there is to help boost the other ingredient to work. Okay, so we have what's called cofactors. And just like with the Stay Young, the citrus bioflavonoids is not in there necessarily to work as an anti-aging by itself. So like if you went to the store and you just got citrus bioflavonoids, it's going to be a great antioxidant, but it's actually in there to help you to absorb and help the other ingredients work more effectively. So, and that's what I love about manufacturing, is because just like calcium, calcium is a great vehicle to help with absorption, okay? But with vitamin C and calcium together, then it makes the calcium actually work more effectively, just like vitamin D. So when you look at a product and you say, oh, well, why do they have that ingredient in there? There's a reason. There's a reason it's in there to work effectively. Now, can we get it all in one canister? Like, I would love to put all my herbs in one product. It would be as big as this, and you'd have to take that capsule, would be that big probably. No, you can't do that, because you got to have, certain ingredients work well together and work more effectively, and you can't have just one pill does it all. That's why we have to supplement with several different ones, because they work efficiently on their own, and as they also work efficiently with the different ingredients that's in there.
So you get that synergistic blend.
Yes, it
Yeah.
synergistically works together.
I love that word, synergistic, because that's it, folks. You got things that work together, where if you were to go to a store and get the individual nutrients by all these different manufacturers, because there's not one manufacturer that has everything, you don't know if they're going to work together or not. And then the ratios, how much of this, how much of that. And then if you do go by the ratios and trying to match up, individual nutrients, you're looking at thousands of dollars.
And that's what a lot of people will do, is they hear an ingredient on the TV, and so they run to the store and go get it. Okay, and then they say, why didn't that product, glucosamine, it didn't work for me. Okay, you guys, glucosamine has to have other cofactors to make it work, and so you can't just take that one ingredient and think that it's going to do exactly what they claim that it's going to do. But if you put it with the right ingredients, it synergistically works together.
Yes, it does. It absolutely does. Well, you had mentioned ADD, ADHD. How about autism?
Okay.
Uh-oh. I think we might have lost her. Or did we lose me?
Oh, okay. Okay. I'm still here. Okay.
Go for it.
Okay. Good. Okay. So with autism, okay, autism is a learning disorder. Okay. And it is, the brain neurotransmitters are not connecting and not firing at the correct time. Okay. And so you want to get them on these type of products as soon as you can. I mean, usually they diagnose autism when the child is around 2 or 3, whenever that learning is coming into play. And so you definitely want to get them on brain food as quick as they can. Same thing with the mother that's breastfeeding. You want to get them also on the products, because the baby needs to get those nutrients. Okay, and so even the EFAs, the Folate Omegas, or something like that, is very important to be able to get the child started as quick as they can on these different products.
Well, and I think we take it for granted. They say mother's milk is the perfect food for babies. But things don't appear in there just magically. We have to be intentional, because if our bodies are not getting the nutrients, how do we expect it to be any in the milk that's being produced for those precious little ones that are in such this massive development age? So folks, nutrition, you can't get it from your food. You've got to be intentional. And I love the fact, it's crazy. You turn the volume off and the alarms still go off. But I love the fact that we are empowered individuals to be able to make choices as long as we have the information. And that's what this program is all about, is to provide education and information to allow you not only to help yourself, but help your families and your communities. And together we can and will help the world become a healthier place. So, Dr. Lara, we do have a hand up with some questions. So let's go ahead and grab a couple questions in our last 15 minutes here. And folks, if you have a question that you would like to ask Dr. Laura about this subject, please feel free to put it, if you're here live with us in the Zoom, you can put it in the Zoom. If you're out on Facebook or YouTube or Rumble, we do have people on our team watching those platforms for those questions. But most importantly, if you have a question and you don't get on the show, make sure that you email us questions@dailywithdoc.com. That's questions@dailywithdoc.com. So, AJ, what questions do you have for Dr. Laura today?
Well, I don't know if you really want me to ask all the questions I have for Dr. Laura, but so I'll just limit it at this point. My first question, Dr. Laura, thank you, Dr. Dennison, thank you for being with us. Is how do you suggest one fixes their gut to protect? You talked about it, but I just kind of want to refresh you, and I do have a second question.
Okay, so you guys, your gut is being compromised all throughout the day, continuously. Okay, and since you brought that up, I'm going to mention also we're talking about the brain, right? And Lorene is going to be on Dr. Conaway's show tonight. Okay, and so if you have that information, you want more information on brain health, Lorene is actually going to be a guest on her show, and Dr. Conaway is the gut guru of longevity. And so, but to protect the gut, you have to, one, you have to do things that you don't want to do. You have to get off the 10 bad foods, okay? Because one, what you put in is always compromising your gut, okay? And so when you think about that, you need to look at food as, is it going to feed me, or am I going to destroy something in the body? So really think about food as something that is a survival more as than a satisfaction, to satisfy the body, okay? Because gluten destroys the healthy villi in the gut, the whole microbiome. So there's many things, sugar, that can actually destroy the gut. So what you have to do is you have to, one, eat healthy, eat for the gut. I love sauerkraut. Sauerkraut is the #1 fermented food that helps with the gut. So you got sauerkraut, kefir, kombucha, pickling. Okay, think about that whenever you're eating. Okay, and that's actually healthy for the gut. So those are my top ones. Yogurt, you guys, yogurt is so overly processed that you're not getting enough active probiotics in there. Okay, and so a lot of people think that they're doing their gut healthy by eating yogurt. Okay, it's really a highly overly processed, and it probably doesn't even have any active probiotics in it. Okay, so you want to eat healthy, you want to take your nutrition like you should, but you need to come back in with probiotics. Okay, so probiotics, the best one that longevity has, and here's the difference of probiotics. When you look at it, yes, the CFP, and also at how many different strains of probiotics is in that probiotic. So the nightly essence has 14 different strains, and each one of those strains, you guys, does something different in the body. Okay, we have healthy bacteria, in our saliva. Okay, our tonsils, is harbors healthy bacteria. Then it goes all throughout your whole microbiome, and each one of those strains settles in a different part of the body. Okay, so when you're looking at a probiotic, you want to make sure you do more strains of probiotics versus looking at the CFUs. Okay, and that's great. That's another one, you guys. I'm going to bring it back in. I'm going to hammer it home, is sleep. Okay, when people say sleep is overrated, you guys, that's when your gut is being restored. So when you're not putting food in the body is whenever the gut is trying to heal itself. Okay, every time you put something in the body, then you're starting the digestive process again. Okay, so intermittent fasting, you guys, is a beautiful way to heal the gut. You stop eating at 6. You don't put anything else in except water. Anything could break your fast, but you take those probiotics at night. Okay, and then you're actually, getting a good night's rest, and you're actually restoring the gut. That is, in a nutshell, what I would do as far as making sure my gut stays healthy, is the probiotics, and make sure that you're eating the right foods and you're getting enough rest.
Just on that particular one, what about something like glucogel? Does that play a role?
Okay, glucogel is the building blocks of many things. One, for gut health, it actually helps to restore the gut flora. And so it actually is a building block for that. You guys, another thing is when you're talking about the gut, and you're talking about the whole digestive tract, you guys, every time you think of it like a snake, okay? And when a snake eats something, it has to move it along and go down. And so we have these muscles, okay, that we also have to have, helping the food to be broke down, and also move it through the toxic waste system, which is go through your colon, and to get rid of it. So glucosamine, glucogel, collagen, MSM, all of those are also very effective to help with the health of the gut and the whole digestive tract. So it is a building block for sure.
You're awesome. Okay, so Deborah had a question. What natural supplements can I use for severe back pain from damaged nerves and inflammation?
Okay, so you want to get on the Healthy Bone and Joint Pack. Okay, you want to take extra glucogel, but add the Stay Restored. The Stay Restored helps with pain. And then I'm going to throw out also a product, okay, is the trauma oil. Okay, the trauma oil is another product that it's an essential oil, and it helps with bones, joints, and muscles. So with her being in that much pain, she could topically put that in with the CM cream, and actually help her body, and so that her body can start healing. So the Healthy Bone and Joint Pack, I would take extra glucogel. I would take 2 bottles of the Stay Restored with that, because that's gonna help with the pain. And then also I would do the trauma oil.
You are fantastic. Thank you very much.
You're welcome.
All right, great questions. Thank you so much, AJ. What happened?
I left.
Did we lose Dr. Laura?
I'm still here. Am I still here?
Okay, you went up as a black screen, so I'm not quite sure.
Ah.
Oh, you are. Okay, fantastic. And Stay Restored is also one that I take. I absolutely love it because it does have those herbs in there, in addition to the glucosamine and the manganese, that help with reducing inflammation, help building the bones and the cartilage and the ligaments and tendons, like you mentioned. Also helps naturally with pain. So absolutely fantastic. This was one of my first Stay Natural products that that I started on and with my bone and joint pack.
Awesome.
So yeah, I absolutely love it. And then, for those of us that don't get as enough sleep,
sleep is everything. Yes.
This is my best friend. I know sleep should be my best friend, but stay energized. Oh my goodness. Sometimes I just take one. That's all I need, and it gets me all day long, but it doesn't interfere with my sleep. It's not that I can't sleep. So when my head hits the pillow, I'm out.
You know,
It's
and
just
if you brought that product up, and I just want to say one thing, because when we came out with it, it was during the ephedra days, okay, and they did away with ephedra, okay, and so when we came out with this product, it has the bitter orange in it, and so it does help with metabolism. It does help with different things like that. But people could just tell that they were focused, and that's, like you said, it's not like a jazzed up energy product, but you just stay focused. It's just, it helps the mind stay focused. It's a great product.
Yeah, I don't get jitters or anything from it. It's, I love it. Absolutely love it, because it is part of supporting a healthy metabolism, not
Yes.
just give you energy. So I know, as people, if you've been listening to the Daily with Doc show, you know Dr. Wallach is really into that whole metabolic syndrome and the metabolism right now. And that Stay Energized is just another component that can be added to a protocol when energy is something that you're lacking. It might be that missing piece. Dr. Laura, thank you so much for being here with us today, sharing knowledge, your wisdom. I just absolutely love it. I was listening to some things that had been sent to me, and one of them had to do with the energy that somebody brings to the room. And I just love the energy that you bring to the room when you are on with us. We, like AJ said before the show, your program where we talked about hormones, those two segments, people have just been sending in questions and information, and some of our highest numbers when it comes to viewership. So you are absolutely a jewel, and we love the fact that you're able to bring time and be here with us. And I think you're going to be here with us the third Tuesday of each month. So that is what the plan is right now. So I look forward to having you on with us each month on the third Tuesday of the month, folks. So mark your calendars. You want to make sure that you're here the third Tuesday. But we're also going to have Dr. Taylor Mitchell on the second Tuesday. And I know that Dr. Joanne Conaway is going to be joining us here as well. I don't know if it's going to be every month, but we'll see what her schedule allows. We have an amazing community. And Dr. Laura, I know you think that as well, where we can work together and just build a healthier world. That's what it's about, folks. Because when the world is healthier, they're going to be having, clearer thinking, less anger, less aggression, more cohesiveness. I mean, all of these words that are really needed in today's day and age. So thank you. Thank you, everyone who joined us here in the Zoom room. I know we had some amazing names that I saw up here as participants and guests in the Zoom room, also out on the different platforms. Thank you for taking the time and joining us here on Daily with Doc. It's an investment into yourself, your family, communities. Share it. If you don't share, you're keeping this information to yourself, and you hear about somebody that's struggling, I hope that really, plays on your conscience. It's like, I've got information that can help them. Don't be afraid to share it. It's like you had mentioned, spirituality. We share spirituality. We share holistic health, because if we're mentally and physically and emotionally struggling, it affects all areas of life. And we're all about a holistic wellness. If I could get my team up with me, we appreciate you, Dr. Dennison, so very much. You are absolutely fantastic. And Albert is here with us. Marty has taken his place, the zebra there. But I couldn't do this program without my team. There's Albert. Okay, thank you. Dr. Dennison, we've got Marilyn. She was putting information into the chat, which is a great reason to be live with us, because that information is stuff we can share in the chat, but we don't get it out onto the different platforms for different reasons, including HIPAA reasons and the privacy of the people that are on the show with us. We have Sherry, who's part of our tech crew, who helps get everything set up, going to the different platforms. We have AJ, who is part of that huge tech crew, very instrumental in getting all of the platforms set up. We have Albert, who looks like he's driving there, who is joining us from South Africa. He helps to let people into the Zoom room so they can actually get in and hear and see live. We've got Coach Rod, who's not on camera, so we can't put him on, up on the screen with us. But he's helping keep an eye on all the different platforms and answering questions and helping let people in as well. And I couldn't do it all by myself. Not at all. Yes, Marilyn has fingers with all her fantastic typing skills. And folks, if you've got skills that you would like to bring to the table and help a community that's helping others, get back with the person that shared this program with you. They can help guide you in how you can use those skills to help others and get a thank you check for helping others. Many of us don't do this for the check. Many of us do this because we truly have a heart for a hurting world. And we're tired of seeing it hurt. There's a lot of things that you as an individual can do to help empower others to find better health. So get back with the person that shared this program with you. If there is no one to thank, feel free to give our call team a call. These are for people that have never taken the products, never referred to or spoke to anybody about Dr. Wallach, Dr. Laura, longevity. We have a call team at 855-949-3377. Again, that's 855-949-3377. Thank you again for joining us here on Daily with Doc. My name is Becca Dukes, and I am honored as a team member within the Independent Distributors of Longevity, and also the Director of Student Services for the Institute of Holistic Health, where you can take it upon yourself to find a better health journey, and we're here to guide you. Bye for now.
Bye. Thank you.
Thank you.
Thank you.